When Obamacare was introduced 5 years ago, it was meant to improve healthcare for millions of uninsured Americans. But one of the most destitute parts of the country is still suffering. A team of nurses is offering their help for free in Appalachia. They call their patients the forgotten people, the working poor unable to break free of chronic poverty. North America correspondent Lisa Miller reports from Appalachia, Virginia.
Along windy roads and valleys, past rich green forests, the Health Wagon makes its way to another struggling community. Every week, this van arrives, delivering hope and help to the poorest of Americans.
Your husband's been calling me, so he's been keeping me up to date on you.
These nurse practitioners offer kindness with expertise.
What I saw was your calcium was low at that time, which I thought could have been, they thought you may have been having seizures. Is that what?
If it ain't seizures, I said, what's going on with them?
They come in, they are train wrecks of patients. They have multiple disease processes going on.
I can remember the conversation.
Constancia Cantrell has fallen through the cracks, not covered by state government health care for the poor and unable to afford to pay for even discounted Obamacare insurance. Without the Health Wagon, she wouldn't have the drugs needed to treat her seizures.
I mean, right here is my medication that they supplied me, 2 bags of it, and didn't have to pay a dime for it.
Which would have costed about $1,000.
Yeah, I mean, it's expensive.
Paula Mead grew up here, but the health worker still finds it difficult to comprehend what life dishes out.
Oh, I think it's terrible. I think it's a third world country phenomenon here in America.
She knows that without the Health Wagon, many people would get no care at all. Generations of coal miners and their families have called this region home, but decades of poor education and nutrition means they're paying the price with their health. Diabetes, heart disease, lungs filled with coal dust.
What did you do to the right side?
It was this bruise and bang up.
The Health Wagon survives on donations and grants, treating 5,000 people a year. Instead of getting better, the situation is actually getting worse. As the workers lose their jobs in the coal mines, they're losing their insurance as well. And the women say the demand on the Health Wagon is greater than it's ever been. Back home, Constancia worries the seizures will return. She's not the only one in the family facing major health problems.
Where they start breaking off, I've had to have a bunch of them pulled.
Offering dental care is one of the ambitions for the Health Wagon. For now, they're doing what they can with limited resources, knowing they're making a difference, one patient at a time. Lisa Miller, ABC News, Appalachia, Virginia.